Welcome to Concussion Talk Podcast. I'm Nick Mercer. This is episode 95. I'm here with Laura Langer, who is the lead author of the study of the concussion Concussion Calculator, which is developed by Toronto Rehab Institute, KITE, UHN, which is University Health Network, and I'll get her to describe that later on. But first, thank my sponsor, HeadCheck Health. Concussion Talk Podcast is presented by HeadCheck Health. HeadCheck Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Track Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more. Okay, now Laura, you welcome to Concussion Talk Podcast. And can I call you Laura or Dr. Laura or
Laura's fine.
Laura's fine. And could you please explain what is I guess basically a bit of your background and what is the KITE, UHN, Toronto Rehab Institute, although Toronto Rehab Institute is pretty self-explanatory. But Toronto UHN and the KITE and then your background, please.
So my background is in neuroscience and biostatistics. I've been working at KITE now for about a decade. KITE is the research arm of Toronto Rehab. It stands for Knowledge, Innovation, Technology Everywhere.
I was wondering that.
Yeah. We like our acronyms.
Yeah. Yes.
Yeah. And it incorporates everything from epidemiological injuries such as stroke and TBI and other neurological disorders, spinal cord. There's a lot of robotics, AI that goes on, and also even smart fabrics. And the mission for KITE is to improve people who have injuries and neurological disorders and also aging, so that they can continue to have a quality of life.
Great. Okay, and you are also the lead researcher for the Ontario Concussion Cohort. So can you explain? I know that's very important to study, and can you explain what that is to people who are not from Ontario, or even people who are from Ontario? I have no idea what the concussion cohort is.
So the Ontario Concussion Cohort is a cohort of everyone in Ontario who was diagnosed by a physician with a concussion between 2008 and 2016. We were able to do this using, it's 1.3 million people.
Oh.
It's the largest concussion cohort in Canada, and we are second largest in the world to the CDC.
Wow. Geez. Yeah. And so the Ontario Concussion Cohort, you use all the data from physician concussion physician results, like their notes, really? Oh, their notes, sorry.
So, not the notes. We use diagnostic billing.
Okay.
With OHIP, which is the Ontario Health Insurance through the government. Every time you go into doctor, you give your OHIP card, they scan it. And when the doctor is done, they submit type of visit, what was the diagnosis, what were any tests that they were doing, and we were able to go into all the doctor billing information and pick out every single person who had a billing code for concussion over those 8 years.
8 years, that's exhaustive for 1.3 million people, million people or million business, million people, I guess.
Yeah.
Much more than a million business. And so I guess now let's start with the concussion calculator. You and Dr. Margaret are the co-lead authors in the study, and you also with 707 other researchers. Is that correct?
Yeah. Yeah, there's another person who is advanced biostatistics, epidemiology, 3 other physicians, and 2 neuropsychiatrists, and a knowledge translation expert.
And there you go. So, but that's a it's definitely a collaborative effort, and you definitely got a lot of expertise in that in your authors list there. So, can you explain to everybody what is the concussion calculator? Well, actually, before you ask that, what was the inspiration for doing this, for making a concussion calculator? I have to put that word.
Well, we always wanted to know what were kind of what factors could predict who was going to have prolonged symptoms. And there's always been kind of stuff that's been suggested, and it's never been really definitive on what does increase the risk. We're pretty sure on a couple things, but we've never really had a large enough sample where you can actually go in, look at some of the pre-existing conditions, some other demographic information, and just see who gets prolonged symptoms. So that was kind of we really want to know what premorbid factors affected people's risk of having a poor outcome after concussion.
And premorbid is before injury for anyone else who's so I'm reading this and not reading it now, but I did read the website about the concussion calculator. There's lots of this talks with the science behind calculator, but I guess the thing people want to know is how did you and how did you decide to come to those 5 questions, and what were, I guess before I ask that again, I'm preempting myself, but what did the study, what were the basic results of the study? What did you find?
So we found that even though there were a lot of factors associated with prolonged concussion symptoms, 5 factors were the strongest and were going to be most likely to predict prolonged symptoms. So that was being older. So that's over 61 years of age. People who go to see primary care frequently in the year prior.
And what would you define as frequently?
Pardon?
What would you define as frequently?
Well, with our data, it was more than 15 times per year.
Okay.
But that wouldn't necessarily translate to other healthcare regions,
right?
On how they fund. But for us, it was 15 times or more per year. People who had a history of anxiety and depression, people who had personality disorders, and people who were diagnosed with bipolar disorder were
Wow. So again, so now how did you actually end up on these, if not with 5 results, but the 5 questions, and that got you asked these questions? Did you just look at the numbers, or?
So we actually did, and this is probably a good thing you're talking to me, not Mark. So I actually did series of more precise statistical kind of wean outs. So I originally loaded in, I think, 20 separate variables originally. And at each step, we looked at the outcome. We saw who had sufficient effect size to be kept in to the next step. And then the final one was the classification and regression tree analysis, where it's kind of a yes-no decision tree for the outcome of prolonged symptoms. And about 99% of the variance of can this predict prolonged symptoms were those 5 final questions. I think leading into it, there was about 13 factors I put in.
Okay, so these questions are more valuable for predictive value as opposed to just necessarily diagnostic value of the concussions. But so what did you can't put 3, I know it's just 3 very general, low, medium, high risk. And so what does that mean?
So it means someone who is low risk, they have a very high likelihood of recovering, and recovering probably quite quickly from their concussion. And probably for those patients, if a doctor sees that they're low risk, I mean, obviously disclaimer, use your best clinical judgment.
Yeah.
Just putting that one out there. Legal needs it stated. These patients probably just reassure them that they're going to be really miserable right now, but they will get better.
Yeah.
And give it a little bit of time. Take it easy. Don't push it too far, but don't also, cocoon yourself.
Yeah.
We're learning a lot that starting aerobic exercise soon after injury is actually really helpful. So maybe.
That's important. Yeah.
Medium risk, these are people who the doctor might want to look into following them for a bit more after their injury, see if there's any symptoms that continue to be an issue, maybe look into starting some preemptive referrals or maybe some pharmacological treatments or sending them off to physiotherapy. These are people you don't necessarily just want to discharge, but you should probably follow them a little bit just to make sure that they're recovering okay. They might have a slightly longer time to recovery, but once again, just reassuring them that it's not guaranteed that they'll have a bad outcome, but just kind of being on top of it. People who are the high risk, these are the ones that the healthcare provider needs to start initiating referrals to immediately, especially with a lot of the high risk population having psychiatric. Probably looping in their psychiatrist would be a good idea at the beginning. If someone is older, maybe reviewing their medical history and just making sure that whatever pre-injury factors that they have going on in their life, it's being addressed. It could be that just they're synergistically working together to make their concussion worse, but these are the people who definitely need to be followed and monitored, and hopefully if they're flagged early enough, they can start initiating more advanced treatment early and maybe increase the likelihood that they could recover, or they'll have a faster recovery, or even just a reduction in symptoms.
Okay, so now the way you were talking, it sounds like this is for obviously a primary care physician or just any primary healthcare worker. And when should they that person who's this for is not for just anybody just to say, oh, look and say, okay, well, therefore I'm going to be stuck like this for a year. But so when should they start when should they assess this uses calculator to assess? When's ideally?
Ideally, it's that time of diagnosis. We also want to make it easy so someone in the emergency department can run it quickly. That's also why we wanted to get down to as few questions as possible so it can be done quickly. But ideally, as soon as possible, but it is valid up until the first 6 months after injury.
Okay. And so has this just came out? Yeah. The date when this came out, this study was published? When was the study published?
Less than 2 weeks ago.
Oh, okay, so I was going to say so. But has anybody used these questions? Have you seen these questions on other physicians that said, oh, I asked this person question number 3, whatever that was, and and question number 5, and during when they were concussed, I found out that as you've seen any physicians or researchers use these questions before, or is these questions you developed by yourself?
These were developed by us. There isn't a risk calculator for adults.
No.
No, there is one for pediatrics that's a few years older, but.
Okay. And are the questions significantly different?
With the one with the pediatrics, they were actually in the emergency department and they were able to actually assess the patients. So there are some balance questions that they were able to include in theirs.
Okay.
We were.
And those yours are primarily psychiatric and not balance or any sort of physical, physical, but no physical challenges. Just depends on the person, obviously, what they can do. And I was going to ask you. So, yeah. I know there's more questions that I had, but this. Oh yes. Prolong. I saw in the global TV article about this PPPS. So or PBCS. Sorry. So can you explain what that? I know post-concussion syndrome, but I know people like the term prolonged concussion syndrome. Is that a combination of the two terms? Prolonged post?
The name kind of, it's changed a couple times over the years. It's The accepted version is prolonged post-concussion symptoms now, but it used to be persisting, and then it's prolonged concussion. The name changes.
Yes.
Yeah.
So how would you define PPCS? Let's use that generic acronym.
Well, for this study, we had to define it as needing multiple specialist visits 6 months after injury. There isn't a formal diagnosis yet, so that made it difficult for us to actually define who is persisting. But we figured if someone was still requiring multiple specialists and a substantial time after their injury, it was going to be a prolonged concussion symptoms.
Okay, and does this calculator, it indicates that they will need specialized medical care, but does it indicate, or do any of the questions help you to decide what type of specialized medical care that will be?
So we looked at neurologists, neurosurgeons, physical medicine, rehabilitation doctors, ophthalmology, ear, nose, throat, psychiatry, somebody else. Those are the specialists we focused on.
Okay, physiatry, psychiatry, neurosurgeons, rehab, both physiotherapists, rehab people, which also the physiatrists really. Yeah. So, and who else? Sorry?
Yeah, it was neurosurgery, ophthalmology.
Ophthalmology.
Yeah.
I can't really forget ophthalmology because right now actually I'm going through using optometrists trying to do vision therapy to try to fix my eyesight, dull vision since my injury was not concussion. It was so actually I ask this then, what does that predictive value over say these questions would they be important for someone like me who now they're not now because way too long after my injury was 18 years ago. But would for a more severe brain injury like concussion, would these questions have any predictive value or any sort of diagnostic value?
I don't know for more severe brain injury. With more severe brain injuries, I think the actual injury characteristics of location of injury, duration of how long someone was unconscious, those seem to be much more important than you would find with concussion. I don't know if, yeah, I don't know if it would be with more severe brain injury. I also think just the way that we were defining the outcome with needing specialist care, you're going to require more specialist care with the more severe brain injury.
And all of these examples were taken from the Ontario Concussion Cohort, right? So how would the concussion cohort? So one doctor defines it that he was in for a concussion, next doctor says he's in for a concussion, but those two doctors can talk about different levels of I mean, let's say any concussion is as severe as a brain injury, but it's not as some people will have longer lessons than right off the bat, and they're just going to have a more severe injury. Say someone who's knocked out for 2 hours, or someone knocked out for a minute. And so, is there any way to tell that? Does that enter into the doctor's calculations or diagnosis?
Yeah. We weren't able to look at injury-specific characteristics like that, just how long was someone out. There used to be a trauma registry for emergency visits, but that was defunded, and we weren't able to collect any information from that. And 20% of our population came from family physicians, so that we wouldn't have been able to read their notes anyway. We don't have electronic notes.
Yeah.
We did, however, with the cohort, to make sure that we were getting people who had concussions and not more severe injuries.
Yes.
Anyone who was admitted or readmitted back to hospital within 30 days of their injury, we eliminated, because we thought that that would be indicative of a slightly more severe injury. We were also looking for certain imaging. If we saw that they had certain imaging ordered, we also excluded them, because that would also be more suspicious of a more severe injury.
So finally, can you name the questions, or is that or is that a legal thing? You can't say what the questions are. So the questions of the study, and where can people find this study?
So anyone can access it, but website is preferred to be for healthcare providers. We don't want people self-diagnosing, but if someone goes to the KITE/uhn.com and looks under tools and looks for concussion calculator, they can find the information about the concussion calculator there.
Excellent. And that's what the best way is to find out what the questions are, as opposed to you just saying it now. People can just decide themselves if they've had a concussion. So yeah, this is for physicians and for healthcare workers or assigned healthcare workers.
Yes, this is for physicians and other healthcare workers who treat adults with concussion.
There you go. So importantly, just not to just use calculator for fun. This is obviously a serious issue and a serious topic. So thank you so much, Laura Langer, for being part of this. Yeah. So I mean, if any other studies you guys are going to do about this, is this last study not yours, because that's like your job, you're the lead researcher, the concussion cohort. But do you have any more concussion brain injury type studies or research coming up in the near future that's exciting to you?
So currently we're using this information for how many people sought specialist care and what type of specialists, and we're calculating out how much it actually costs per year and per patient. So currently working on that. That's really exciting.
Yeah.
And I have some other clinical decision rules that are about to be submitted soon. So
I'll keep that under wraps until they're approved.
Yep.
And yeah, so thank you so much. And again, can you just tell people where they can find where physicians and health workers who deal with adults with concussion, where they can find this calculator, concussion calculator?
Sure, it's on the KITE/uhn.com website. Look under tools, and it is the concussion calculator.
Well, great. Thanks so much, Laura.
Thanks.
Music at the beginning of this podcast is by Ben Sound. www.bensound.com.